An effective sedative agent reduces anxiety and exerts a calming effect. A hypnotic drug produces drowsiness and encourages the onset and maintenance of sleep. A sedative hypnotic, then? Well, as you'll soon see, you're in for all kinds of central nervous system depression. And on that note, I'd like to welcome you to Ben's Diner, where we're going to introduce some of the most widely used sedative hypnotics, the benzodiazepines. The spoons may be greasy and the booths uncomfortably sticky, but one thing's for sure, you're gonna love their pancakes. They're the best in town. Yeah, you heard me right. Pancakes, as in diazepam, lorazepam, oxazepam. Just a few of the benzodiazepines we're gonna cover in this sketch. Benzodiazepines can be classified as either short-acting or long-acting agents, depending on their onset and duration of action. Let this charging ox, prompting customers to act fast, remind you of the short-acting agent oxazepam. Also, the words all-am highlight the olam suffix common to many of the other more short-acting benzodiazepines, including triazolam, alprazolam, and midazolam. Because of their short serum half-life, these short-acting agents are more likely to lead to physical dependence. Therefore, they're more likely to cause addiction, as evoked by the addictive flavor that will have you coming back to Ben's Diner time and time again. See this liver spot here on the oxazepam ox? The short-acting benzodiazepines such as oxazepam, alprazolam, and triazolam exert such short-lived pharmacologic effects because they're rapidly metabolized and inactivated by the liver. In fact, hepatic metabolism accounts for clearance of all benzodiazepines. But here's the key difference to keep in mind. The long-acting agents, such as diazepam and chlordiazepoxide, form active metabolites at the liver. These biologically active molecules have half-lives up to 100 hours and exert lasting pharmacologic effects. Also, multiple doses can lead to cumulative effects leading to increased risk of toxicity, so be careful when prescribing benzos to very old patients or patients with liver disease. Altered hepatic function can cause significantly increased serum half-lives of these drugs. Benzodiazepines work by binding to an allosteric site on the GABA-A receptor, facilitating its action. At Sketchy, our recurring symbol for GABA is the GABA cab. So, outside, one of the waiters is delivering a to-go order to the GABA cab driver. GABA, along with glycine, is a major inhibitory neurotransmitter in the CNS, hence the CNS-themed taxi light on top of the cab. Benzodiazepines potentiate GABA-A transmission throughout the central nervous system, including the spinal cord, cerebellum, and cerebral cortex. Remember, you're enhancing GABA activity here, not blocking it. Just like this special delivery of pancakes is sure to enhance our cab driver's job performance this morning. However, GABA is an inhibitory neurotransmitter. So, overall, benzodiazepines have a depressive effect on central nervous system function. The GABA-A receptor, once activated, functions as a chloride ion channel. So, take a look at the advertisement on top of that GABA cab. My friend, you're taking a ride on the Clo Rider. Increased chloride conductance inhibits synaptic transmission throughout the CNS, leading to CNS depression, evoked by their slogan, "Take it easy." Increased chloride permeability at CNS neurons hyperpolarizes and stabilizes the membrane, rendering them less excitable. Remember, benzodiazepines do not substitute for GABA, but instead enhance GABA's effects by binding to a separate allosteric site on the GABA-A receptor. Do you see where we've labeled this cab Cab-A? Think of this door as the binding site of GABA, where a passenger can get in and activate this Clo Rider. The other doors around the cab, then, are kind of like separate allosteric sites. And we'll soon see that numerous sedative hypnotic agents are able to modulate the activity of GABA by binding this receptor. When benzodiazepines bind to their unique site, the resulting enhancement in chloride ion channel conductance is due to an increase in frequency of ion channel opening, not an increase in duration. So because this is a breakfast place, it's not going to be open past AM hours. However, take a look at the sign on the door. They're now open more frequently, so you can get your pancake fix 7 days a week. All right, take a look again at that Cab-A outside. Cab-A not only represents GABA, but the GABA-A receptor specifically. You see, GABA receptors are divided into three subtypes: GABA A, GABA B, and GABA C receptors. The GABA A receptor is the main site of action of benzodiazepines. It's composed of 5 subunits that together form a chloride channel, which primarily mediates neuronal excitability, mood changes, anxiety, and sleep. You know what other agent affects these CNS functions? Alcohol, of course. Probably the most widely used sedative hypnotic. This guy, leaning against the back of the cab, he represents alcohol, a CNS depressant that also binds to the GABA A receptor complex at yet another allosteric site, enhancing the inhibitory tone of GABA. Just remember, GABA A as in A for alcohol. Chronic alcohol consumption leads to decreased GABA sensitivity and alcohol tolerance develops, meaning you need to increase intake to get the same effects. And abrupt cessation of alcohol causes a decrease in GABA-mediated inhibitory tone, resulting in the opposite, actually, CNS excitation. This is what characterizes alcohol withdrawal, and in front of the diner, the 3 stages of withdrawal are depicted by our 3 patrons here, who've ordered that Ben's Diner classic, the Hangover Special. Alcohol withdrawal symptoms typically start within 8 to 12 hours after the last drink and include insomnia, tremulousness, anxiety, and autonomic hyperactivity, which includes variable blood pressure, diaphoresis, and tachycardia. Just take a look at our hyperactive patron here, who's clearly depicting that tachycardia, diaphoresis, and I'm definitely seeing some tremulousness there. Within 12 to 48 hours, alcohol withdrawal seizures can occur, hence the seizure-evoking, sketchy action lines displayed by our next patron as he's falling from his stool. And finally, within 48 to 96 hours is when delirium tremens typically occurs. Now keep in mind the delirium part of delirium tremens, because this syndrome includes fever, disorientation, and severe agitation. And that's why our last customer is expressing some severe agitation as he demands service. And out comes the first order of the day, an absurdly tall order of those golden fluffy pancakes. Benzodiazepines are first-line therapy for the psychomotor agitation associated with alcohol withdrawal and to prevent progression to seizures and delirium. Long-acting benzos with active metabolites such as diazepam or chlordiazepoxide are preferred in the majority of patients due to their self-tapering effects, which results in a smoother course of withdrawal. So, sitting atop this uncomfortably tall stack of pancakes is a long tapering flag, our recurring sketchy symbol for the extended serum half-life of long-acting drugs. Remember, however, that all benzos are metabolized by the liver, and it's the long-acting agents that form active metabolites, prolonging their pharmacologic effects. In patients with cirrhosis or alcoholic hepatitis, these active metabolites tend to accumulate, leading to oversedation. Therefore, short-acting benzos that are more rapidly inactivated and have no active metabolites are preferred in the setting of hepatic insufficiency, such as lorazepam or oxazepam. Okay. So, as you can see, treatment and prevention of seizures is an important component of the management of alcohol withdrawal. In fact, alcohol withdrawal is one of the most common causes of seizures in adults. And when given IV, benzodiazepines are able to provide rapid treatment of severe withdrawal reactions. Our recurring sketchy symbol for IV administration is that climbing IV. IV, of course. IV benzodiazepines are useful for more than just alcohol withdrawal, however. Notice that we've placed IV next to this construction worker outside who's clutching onto his jackhammer as it shakes uncontrollably. We'll bring back this seizure-evoking hammer operator whenever we want to highlight the agents used in the management of epilepsy. Benzodiazepines, when given IV, are highly effective in stopping continuous seizure activity, especially status epilepticus, which is when recurrent or continuous generalized tonic-clonic seizures last for more than 30 minutes without return to consciousness. So, as his friend rushes over to unplug the machine, remember IV benzodiazepines, such as diazepam and lorazepam, used for the acute control of seizure activity. And check out our anti-epileptic unit for more info. Now, benzodiazepines such as diazepam, lorazepam, and midazolam are also used intravenously for anesthesia, usually in combination with other agents. And underneath the IV, it looks like one of our customers is looking a little sedated as he waits for his order? Also, see that straw dangling from his mouth? Let it evoke an image of an intubated and anesthetized patient waiting for surgery. And here's the thing though, many diagnostic and minor procedures can be performed without general anesthesia using sedation-based anesthetic techniques. During a colonoscopy, for example, IV benzodiazepines can be used to induce a state of conscious sedation when the patient's able to maintain a patent airway and even follow commands during the procedure. The light, calorie-free beverage in front of him, then, represents the light anesthesia that can be accomplished with IV benzodiazepines during minor procedures or surgeries. Alright, we've gone over sedation, but a sedative hypnotic wouldn't be called a sedative hypnotic unless it could also cause hypnosis or sleep, right? Benzodiazepines are commonly used for the short-term treatment of insomnia, hence the patron in the back succumbing to a pleasant food coma after devouring a stack of those pancakes. As we'll soon see, however, using a benzodiazepine as a sleep aid can be problematic due to unwanted side effects and the development of tolerance and physical dependence, but we'll get to that in a little bit. Since we're talking about hypnosis, I want to mention that benzodiazepines can also be helpful when managing parasomnias in children, such as sleepwalking or night terrors.
Are your kids keeping you up all night? Nothing a plate of piping hot pancakes can't fix.
Benzodiazepines are also frequently used as central muscle relaxants. And it's sketchy, whenever we want to convey skeletal muscle relaxation, we'll sketch in a comfy reclining chair. What? They have reclining booths here? Oh, it supports and aligns. Diazepam, for example, can stop the spasticity that's caused by upper motor neuron disorders like MS, strokes, spinal cord trauma, and even tetanus. Gotta be careful, though. Benzos will also produce sedation at the doses required to reduce muscle tone.
Oh, I really don't care, though, because right now it feels like my lumbar back is getting caressed by some sort of, like a fanny pack made of dreams.
The benzodiazepines are also widely used for the management of acute anxiety states. For example, they can be used to treat the symptoms associated with generalized anxiety disorder, or GAD. GAD involves excessive or unreasonable anxiety about life circumstances, such as anticipation of a frightening medical or dental procedure, an illness in the family, or, suddenly realizing that you can't pay the bill on your first date with this girl who you really want to impress. And then she says, "Oh no, that's okay, we can split it," which is of course code for "let's just be friends." Didn't have to be this way, Cassandra. Where was I? Oh, GAD. Acute anxiety can also be accompanied by other symptoms such as headaches, muscle tension, and insomnia. And benzodiazepines can be used to reduce the emotional and somatic symptoms of GAD within minutes to hours. Benzodiazepines have also been used in the management of panic disorder. Patients with panic disorder experience recurrent panic attacks, typically presenting with spontaneous, discrete episodes of intense fear that begin abruptly and last for several minutes to an hour. Patients may also present with other symptoms such as chest pain or shortness of breath, and they usually have excessive worry about future attacks. But here's the thing, though. The first-line pharmacologic treatment for generalized anxiety disorder and other conditions such as panic disorder and agoraphobia is not a benzodiazepine, but usually a serotonin reuptake inhibitor such as an SSRI or an SNRI, and the rest of this sketch is dedicated to showing you why. There are numerous disadvantages that limit the use of benzodiazepines as a long-term therapy for patients with anxiety. Let's start with tolerance, one of the outspoken traditions here at Ben's Diner. It doesn't matter your gender or creed or whether you prefer Matthew McConaughey's work pre- or post-McConaissance. All are welcome at Ben's Diner. Tolerance, though, is also a term used to describe decreased sensitivity to a drug's effects after long-term use. It turns out that chronic benzodiazepine use results in downregulation of the GABA-A receptor complex. This leads to decreased GABA sensitivity and tolerance develops, meaning you'll need to increase the dose of benzodiazepine to produce the same pharmacologic effects. Not only that, physical dependence can develop, which means that your body adapts to chronic use of a drug. And if the drug is stopped abruptly, you'll start experiencing some withdrawal symptoms. So, because alcohol works in much the same way as benzos, when you're trying to remember the withdrawal symptoms of benzodiazepines, or any sedative hypnotic for that matter, just think of alcohol withdrawal symptoms depicted by our 3 hangover specialists at the front of the diner. Withdrawal can include tremors, anxiety, perceptual disturbances, dysphoria, psychosis, and even seizures. All in all, because of tolerance to increased dosages and physical dependence to the drug effects, patients are at an increased risk of developing addiction, hence that addictive flavor advertised on the back wall. So, if your patient has a history of substance abuse disorder, benzodiazepines are probably not your best option. Now, the most common side effects of benzos result from their dose-related depression of the CNS, being sedative hypnotics and all. So keep in mind all those sedated customers waiting in the comfy booths at the front of the diner. Even low doses of benzodiazepines can lead to drowsiness, impaired judgment, and diminished motor skills, job performance, and driving ability. Benzodiazepines may also cause significant dose-related anterograde amnesia, impairing the ability to learn new information. See the amnestic ? Cap worn by our lightly anesthetized patron here? It turns out that this effect can actually be used clinically. During uncomfortable procedures like endoscopy, benzodiazepines are used to create a level of sedation where the patient is able to cooperate during the procedure but is amnestic to it afterwards. So it was uncomfortable, you just don't remember it was uncomfortable. There's just so many existential implications. Let's just move on. Elderly patients are more sensitive to the effects of benzodiazepines. In fact, the most common reversible cause of confusional states in the elderly is the overuse of sedative hypnotics. And that's why this elderly patron here is looking a little confused and disoriented as he comes to terms with the surprisingly tall stack of pancakes that he accidentally ordered. Benzodiazepines may also impair coordination and balance, leading to central ataxia. So, as this leaning tower of pancakes begins to topple over, remember that sedative hypnotics are often avoided in the elderly due to increased risk of falls. As a class, benzodiazepines should not be co-administered with other CNS depressants, including alcohol, barbiturates, neuroleptics, or first-generation antihistamines. At Sketchy, histamine is represented by an allergy-inducing bee. Antihistamines, therefore, are embodied by that recurring bee swatter, of course. Think back to our Midsummer Night's diphenhydramine sketch, where we discussed how first-generation antihistamines act by blocking both central and peripheral H1 receptors. They easily penetrate the blood-brain barrier to cause potent sedation, especially in the elderly. So, when that seasoned patient walks into your office with a medication list longer than the list of other things you could have bought with your medical school tuition money, just look out for interactions between agents that can depress CNS function. This includes barbiturates, of course, and as a little preview of our next sketch, look outside and recall that numerous sedative hypnotic agents are able to modulate the activity of GABA by binding to allosteric sites on the GABA-A receptor. Benzodiazepines, alcohol, and now barbiturates, represented by the friendly neighborhood barber here who opens the door of the GABA cab for his latest satisfied customer. One last thing, if you need to rapidly reverse the sedative actions of a benzodiazepine, flumazil is your antidote, represented here by this fluffy dog wearing a muzzle. Down, Fluffy, down! Flumazil is a competitive antagonist of the benzodiazepine receptor, and that's why this cuddly canine is competing directly for those pancakes as the delivery guy tries to make it over to the GABA cab. Flumazil can be used to reverse benzodiazepine-induced sedation following general anesthesia, procedural sedation, or overdose. However, the use of flumazil in the setting of overdose remains highly controversial. Administration of flumazil can precipitate withdrawal seizures in patients who've developed a tolerance to benzodiazepines through chronic use or abuse, so watch out.
Oh man, those pancakes pack quite a punch. I don't know if it's a food coma
some kind of food poisoning setting in, but before I collapse, I just wanted to do a witty segue into our next